we still got a few people joining us, but I think we'll kind of get started. Hopefully those that asked these questions are tuned in, but the video will be up for another 24 hours on the page, and I'm gonna try and properly save it this time, and then I think Jordana posts to YouTube. So thanks again to her and Cravings for having me come talk about breastfeeding, which I love to do. So one of the first questions was, how do you help baby latch? So the most important thing is just that you are in a comfortable position that works for you. Whatever breastfeeding position that is, it really doesn't matter. Just find one that works for you, that you feel comfortable in, that you feel relaxed in. And then what you want to do basically is have baby kind of straight from head to shoulders to hips as you're holding them like this, or football or sideline, whatever works. And then not having them turn. Hi everyone joining. Just got a whole bunch of people. So Dr. Emily Sullivan talking about breastfeeding, just going over some questions from last time and then some popular topics. So talking about latch right now, making sure you're in a comfortable position, having baby kind of generally straight from head to shoulders to hips, and not having baby turn to the breast. So you don't want baby's head turning and sucking like that, and their body to the side. You want to make sure that their head is straight with their body, and in general their body is pressed up against yours, like skin to skin preferable, especially if they're younger. And then the most important thing is, I'll try to make this come across good on the video. So often as soon as people put them on, the baby's kind of nipple, this is the nipple here, the nipple is at the mouth, and then they just kind of open up like this and eat like that. But what you want is, before they latch, when you place them in front of you, you want the nipple to really be at the nose, because then what you want them to do is to lift up, open wide, and have a nice big latch as they start nursing. And it's the same thing if we were gonna eat like a big hamburger or something. You wouldn't kind of have it down here and trying to open like that. You would like lift it up, open your mouth really wide, maybe put your head back a bit, and then take a big bite. So yeah, just that's gonna be kind of the best way to encourage baby to take a nice wide open latch by themselves. Hopefully that came across okay in the video. Yeah, so, and then I mean, if you are having troubles with latch, the lactation consultants that work kind of with a Healthy at Home in the hospital, and then at West Winds and in Stonebridge, they're all really great. They're the like lactation and breastfeeding position experts, and then you can come see me as well if you have more questions about that. Another question was, so will baby get enough milk if they're sleeping through the night? And so almost always if babies are sleeping through the night, especially if they've done it on their own without like sleep training, they'll make up for it by increasing feeds throughout the day. So the most important thing you can do if your baby is sleeping through the night is just feeding them on demand during the day, and offering them the breast as much as possible during the day so they can make up for it, and then they're fine to do those longer stretches at night. That being said, so an exception to this is babies who have jaundice, or if they're like unwell, premature, or have other medical conditions. So jaundice is generally the most common that a lot of people deal with in kind of the newborn period. So if they have jaundice, then they won't wake up on their own to nurse during the night or during the day. So those babies, talk to your family doctor or pediatrician about how often you should be waking them. Usually it's every 2 to 3 hours, but in general for especially older babies, once they start sleeping through the night, they'll make up for it during the day, and then just be sure to offer and nurse on demand a lot. So another question was what to do if baby is latching preferentially to one breast. So kind of things to troubleshoot, try different nursing positions. Like I said, the most important thing for a nursing position is that you are comfortable. And we all have, you know, like even grandparents, you'll notice that they'll hold the baby on one side every time. We just have a preference. So trying to make sure you can be comfortable holding them in whichever position that is on that side that you're wanting to nurse them on. And then sometimes you can try nursing them on the breast that they're not wanting to nurse first. If they have a fast flow preference, then that will maybe let them bring them to that breast better, or trying them on that breast second. If they kind of have a slow flow, just like to suckle preference, then they might prefer that. Another thing would be making sure that the baby doesn't have torticollis. And what that is just means they have like tight neck muscles. One way that can happen, so sometimes that can happen like if when they were in your belly, they were always like had their head a certain way, or during birth or C-section, if they came up quickly or something like that. But another common way that can happen is just they lie beside you in bed in their bassinet or whatever, and they always want to look at you. So like all night they're kind of turning a certain way. So it's just tight neck muscles that make them look kind of one way more than the other. That can be a possible reason why they're just preferring one breast. You can have your doctor assess for that, or me. I generally send them to physiotherapy, and then they just give you like very gentle stretches, encourage baby to be have their head on different sides of the bassinet, so they're always looking different ways. And then if they are really starting to only prefer one breast, often the other breast will especially like can lose quite a bit of supply. And then sometimes if they're a baby that really likes fast flow, then they will really start to not like that breast. So sometimes you actually have to pump that breast quite often to bring back the supply, to bring baby back, so that they're like, okay, this breast has milk too, it has the flow that I like. And hopefully that'll bring baby back. That being said, so this is an issue that I commonly see too. So I'm happy to see and troubleshoot and see if any of those things are going on or what. And then same with the lactation consultants. They're really the like latch and breastfeeding position experts. So that would be a good question for them. Excuse me. So another question was decreasing night feeds in a 16-month-old. So a 16-month-old in general, if they're healthy, doesn't like need to breastfeed through the night. Usually, I mean, with this horrible cold weather, we've all been like cranking our thermoses, and I know like I've been waking up thirsty, like needing a glass of water because the house is just so dry and hot. So it's definitely possible that, they might need their thirst quenched as well. But in general, older babies like that don't need to nurse at night. So it's really up to you how you would want to night wean them. There's just like cold turkey, cry it out, leave them there on the one end of the spectrum. And then on the other, there's like Jay Gordon. You can just search on Google Jay Gordon night weaning, and it's really like gentle, like cutting down slowly the time that they're at the breast and things like that. If they are, if they have a good understanding, you can talk to them, you can tell them, can only have milk when the sun is up. And there's books that you can buy or get at the library about that too. It's like Nurses When the Sun is Up or something like that. It's like a picture book that you would read with your baby to kind of show them that they can't have milk at night. And same thing, there were some questions about just weaning baby. So kind of the same thing. So that being said, as long as they're over a year, then they don't need breast milk or formula as their primary source of milk. But obviously, like nursing past that has benefits for both baby and mom. But if you're wanting to wean them and they're over a year, it's kind of up to you what end of the spectrum you want to wean them. In general, it's kind of easiest for baby and mom to slowly cut out one feed at a time, kind of targeting the easiest one and ending with the hardest. Usually the easiest one is, like a midday if you're gone during the week, and you just do that on weekends, or first thing in the morning, you can like play and give them breakfast instead. And then usually the hardest is like just before bedtime, unless someone else routinely puts them to bed. But yeah, I'm happy to see you and talk about weaning for younger babies, older babies, like toddlers and beyond. So another question was getting an exclusively breastfed baby that direct breastfeeds all the time to take a bottle. Kind of depends on whether they are younger or older. So if they're like quite young still, like a few months old or whatever, you can try things like syringe feeding or the S&S, like at the finger, so it's like little tubing, and then they would suck your finger, or cup feedings, like having a little shot glass or something and you feed them like that. If they're just a few months, those would be alternates to the bottle. And obviously, like, just keep offering the bottle. You can try different nipples and things like that, but sometimes you can drive yourself crazy buying like 10 different bottles and none of them work. So yeah, maybe moving to other options. And then, so if they're an older baby, say like 4 or 5, 6 months or beyond, then you can try offering like cup feeding again, where they like actually drink out of a cup, or straw or sippy cup, or those like 360 cups. I'm pretty sure you can get those at Cravings, where it has kind of like a lid so you don't spill all of your milk. That being said, it's nicer if they're kind of like 6 months or older and you can practice those things with, you know, a cup of water or cow's milk or whatever, instead of like risking spilling a bunch of your milk. But yeah, just trying different bottles, but then, you know, not being afraid to move on to other options other than bottles. There is also, so everyone has something called lipase in their breast milk. It's normal, it's healthy, there's no problems at all in general, but when we express the milk, the lipase starts to break down the milk, and that can change the taste of the milk. Some babies don't notice or care at all, but other babies will not take it. You can kind of give the milk a sour smell or taste, and some babies will refuse that. And it happens, it starts to happen like as soon as we express the milk. So if it's in the fridge and you smell it and it smells sour and you think you have lipase, unfortunately there's nothing you can do about that milk. You could try cutting it with other milk, but you can, so as soon as you express it, you can stop the lipase from breaking down and that happening by scalding the milk. So you would like put it in a pan or whatever, and not bring it to a boil. You just like heat it enough that the bubbles start forming around the edges, and then you would cool it immediately, and that should stop the lipase from breaking down and from the milk changing flavor, if that's a problem that you're having.